Hello everyone, welcome back to my channel. Today I will be presenting slides on the topic salivary glands for the head and neck anatomy series. So let's get started. From the three major salivary gland, parotid, submandibular and sublingual, let's discuss first about the parotid gland. So now the parotid gland, it is a bilateral salivary gland. It is located in the face. The main thing we need to remember is that it produces serous saliva, that is a watery solution, which is rich in enzyme and that facilitates both in lubrication and in the breakdown of food. Now, this is something interesting that a part of its forward extension is often detached, which is called as accessory parotid. And this accessory parotid lies between the zygomatic arch and the parotid duct. Now, the main thing, the parotid gland is divided into deep and the superficial lobe, and these are separated by the facial nerve. Okay. It lies within a region called as parotid region, and this parotid region is between the posterior border of mandibular ramus and the anterior border of sternocleidomastoid muscle. Okay, that is where the parotid gland lies. We can see in the diagram the parotid gland, which is the yellow color structure. So we can see superiorly there is a zygomatic arch. Inferiorly, there will be inferior border of mandible. Anteriorly, there will be masseter muscle. Posteriorly, there will be sternocleidomastoid muscle. So these are the boundaries of parotid gland. Now, the secretion of parotid gland is via the Stenson's duct, that is the parotid duct. Now, this duct pierces the cheek and buccinator muscle and empties its secretion next to the maxillary second molar. This is important, that maxillary second molar is the place where the parotid duct opening is present. Okay, so the most important slide, the structures within the parotid gland. I think this is the most beautiful diagram which I have come across. The facial nerve is the main nerve which is present within the parotid gland, and it divides into its 5 terminal branches, that is temporal, zygomatic, buccal, mandibular and cervical. To remember, we can have this mnemonic: to Zanzibar by motor car. Okay, so that's how T, Z, B, M and C. Now, talking about the blood vessel, the external carotid artery is the blood vessel which surrounds the parotid gland, and it divides into its branches, that is posterior auricular artery and its two terminal branches, maxillary artery and the superficial temporal artery. If we talk about the venous drainage, so the superficial temporal vein which combines with the maxillary vein and it forms the retromandibular vein. Now this is super duper important. The retromandibular vein then further divides into anterior division and posterior division. So the anterior division will join the facial vein and form the common facial vein, while the posterior division, it will join the posterior auricular vein to drain into the external jugular vein. So P is for posterior auricular vein, P is for the posterior division. Now, as we discussed earlier, blood supplies through the posterior auricular and superficial temporal arteries. These are both the branches of external carotid artery. Along with external carotid artery, blood is also supplied through transverse facial artery. Okay. Now, venous drainage. Venous drainage is via retromandibular vein, and we have discussed earlier about retromandibular vein, how it divides into anterior and posterior division. To recap, posterior division will join the posterior auricular vein, which will ultimately drain into external jugular vein. The anterior division will join the facial vein, which forms the common facial vein. Okay, so that's all about the blood supply and the venous drainage. The most important thing now, the innervation. Whenever we will talk about innervation, we will basically talk about sensory innervation and autonomic innervation. Autonomic will be further divided into sympathetic and parasympathetic. Just one thing to remember, that the autonomic is the one which is responsible for the control of rate of saliva production. Now coming to the sensory innervation. Sensory innervation basically is via auriculotemporal nerve, which is the one which is responsible for the sensory innervation to the whole gland, and the great auricular nerve, which is for the fascia of the gland. Sympathetic innervation. Basically, just remember it is from the superior cervical ganglion. And the important thing to remember about, increase in the sympathetic nervous system will inhibit the saliva secretion via vasoconstriction. So the most important slide and the most important thing to remember is the parasympathetic innervation. Whenever we will talk about parasympathetic, we will always describe in three terms: preganglionic fiber, its synapse, and the postganglionic fibers. Now, as we can see in the diagram, it starts from the inferior salivatory nucleus. Then preganglionic fibers run through the lesser petrosal nerve, which is a branch of glossopharyngeal nerve. It synapse into the otic ganglion, and the postganglionic will leave the otic ganglion. It will travel via the auriculotemporal nerve to reach the parotid gland. Lymphatic drainage. So the lymph will drain first into the parotid nodes. From there, it will go to the upper deep cervical nodes. So I think that's all about the parotid gland. Thank you so much for watching the video. I hope you liked it. And in the next video, I'll be talking about the submandibular and the sublingual gland together. So stay tuned. Till then, all the best for your preparation. Have a good day. Bye.